Good morning, everyone, or good afternoon, good evening, depends where you are in the world. First, I would like to thank everybody who was able to attend the session today. My name is Agnieszka Stoyanov, and on behalf of NNAS, I will be leading today's presentation on starting internationally educated nurses on their journey to nursing practice in Canada. During today's webinar, we will discuss the following items. We will do an introduction to Canada, followed by an introduction to NNAS. We will do a brief review of the Canadian nursing regulatory bodies and nursing designations. We will do a review of the NNAS application process for both our new expedited service as well as our regular service. Later on in the presentation, we will review some tips and strategies to help you successfully complete your NNAS application. And finally, we will give you the chance to ask questions. All attendees will be muted for the duration of the webinar. You can enter questions in the question and answer box. Questions will be answered in the last 10 minutes of the webinar. Please do not provide any personal information such as your NNAS ID. We do answer all questions. We may not be able to answer all questions here during the webinar time, but we answer by email to everybody who submitted a question and whose question was not answered during the webinar due to time limits. In the end, you will receive a survey following the webinar to provide your feedback. We would like to begin this conversation by first acknowledging that the land on which our head office is located is the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the New Credit First Nation. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. We must always remain mindful to not speak in the past tense, as the effects of colonialism are very much current and ongoing. We must be mindful of how we continue to benefit as settlers on Indigenous lands. Canada is the second largest landmass in the world. It has a population of 38 million people. As you see in the image on the screen, Canada is made up of 10 provinces and 3 territories. From west to east, these include British Columbia, Alberta, Saskatchewan, Manitoba, Ontario, Quebec, Newfoundland, New Brunswick, Nova Scotia, Prince Edward Island. And on the top of the map here on the screen, you see the 3 territories, Yukon, the Northwest Territories, and Nunavut. We have a national federal government in Canada, and then each province or territory, in addition, has their own provincial territorial governments. In Canada, healthcare delivery is at the provincial level. This means that each province or territory has their own healthcare processes. Canada has 2 official languages, French and English. New Brunswick, which is on the east coast, is the only official bilingual province. Quebec is predominantly French-speaking. The 3 territories in the north part of the country have also official Indigenous languages, in addition to English and French. NNAS was established in 2012 by the federal government of Canada, all the regulatory bodies, and some provincial governments in Canada. This represented a real first in that the regulatory bodies and governments recognized a Canada-wide approach. Sometimes this is referred to as the pan-Canadian approach, to this first part of the journey that internationally educated nurses, when interested in practicing as a nurse in Canada, need to take. We are a not-for-profit organization, and we actually opened our doors in 2014. I say doors with quotation marks around them because we are a virtual organization, meaning staff work from home from offices across Canada. NNAS is a credentialing service. We provide a consistent approach to collecting, verifying, and storing documents that all nursing regulatory bodies in Canada require, except Quebec and the 3 territories in the north, Yukon, Nunavut, and the Northwest Territories. We are the first stop or the first step in the journey that internationally educated nurses need to take who would like to practice nursing in Canada. We have been working really hard to improve our processes to issue advisory reports. Since April 2023, we have already issued over 15,000 advisory reports, the same amount we issued all of last year. NNAS does not grant licenses to practice nursing, but we do provide the assessment services that will result in a record called an advisory report that will be going to the regulatory bodies into the provinces that you choose. NNAS does not have a role in making decisions about licenses, nor can NNAS advocate on behalf of any applicant. Only nursing regulatory bodies have the authority to decide whether an application is successful. The regulatory bodies will review your credentials and all the other information gathered to determine what your next step in the process of getting registered will be. Nursing regulatory bodies in each province set the registration criteria. Therefore, it is important for all applicants to carefully review the licensing requirements of the regulators where they wish to apply. And I mentioned the advisory reports issued in 2023 when we started the expedited process. I would also like to mention that between April this year, 2023, and April 1st, 2024, in other words, the last calendar year, we issued 24,066 advisory reports to regulatory bodies. NNAS is the first step in your journey to becoming licensed as a nurse in Canada, and the focus of today's webinar will be on the NNAS application process. However, the purpose of this slide is to show that there are other stakeholders that will be part of your journey, such as nursing regulatory bodies, education bridging programs, and employers. NNAS is here to be a resource to help you connect with these stakeholders for questions you may have about their specific roles. Internationally educated nurses wanting to practice in Canada must be registered with the regulatory body in the jurisdiction, in other words, in the province or territory, where they plan to practice. Canada has 26 nursing regulatory bodies, with some provinces having more than one nursing regulatory body. Each regulatory body is separate from one another, even in the provinces with more than one nursing regulatory body. When an internationally educated nurse starts the application process, first they have to decide in which Canadian province they want to live and work. Each regulator has their own unique processes and registration requirements for internationally educated nurses. Unlike other countries, Canada does not have one national regulatory system. Rather, each province and each regulator has their own unique regulatory system in place. In addition, being licensed to practice nursing in one Canadian province does not mean that you can practice in another province without first going through that other province's licensing process. And these are all the provincial regulatory bodies that are members of NNAS, and where, after you complete the NNAS process, your advisory report will go. Your credentials will be reviewed, and the decisions will be made on what your next step in the process of getting licensed will be. All the nursing regulatory bodies, excluding Quebec, Yukon, Nunavut, and the Northwest Territories, are members of NNAS and accept our advisory reports. In Canada, there are 3 different nursing professions. We are responsible for doing the assessment of the education and credentials of all 3 professions. The first is a registered nurse, and registered nurses are in place across Canada. The next is the licensed practical nurse. They are also a regulated profession in all provinces and territories. It is important to know that both Ontario and Quebec use the term registered practical nurse instead of licensed practical nurse. And the last nursing profession we have are the registered psychiatric nurses. That profession is only available in the western part of Canada. So the provinces that actually license psychiatric nurses are Manitoba, Saskatchewan, Alberta, and British Columbia. It does not mean that you cannot practice in that setting if you are a registered nurse. You just need to have the specialized kind of education in those 4 provinces to get registered as a psychiatric nurse. Becoming a registered nurse in Canada usually requires a 4-year university program that leads to a nursing degree. The program includes theory and clinical instruction in medical and surgical nursing. A registered nurse is a generalist nurse with the skills to work with all types of patients and in all clinical settings. Becoming a licensed practical nurse in Canada usually requires a 2 to 3 year college program leading to a nursing diploma. Training includes theory and clinical instruction in medical and surgical nursing. A licensed practical nurse is a generalist nurse with the skills to work with all types of patients, although their scope of practice is more limited than that of a registered nurse. Registered psychiatric nursing is a regulated profession in British Columbia, Alberta, Saskatchewan, and Manitoba. In these provinces, becoming a registered psychiatric nurse usually requires between 2.5 to 4 years nursing education at college or university level. Registered psychiatric nursing programs include theoretical and clinical training in psychiatric and general nursing. You can learn more about the 3 nursing professions in Canada on our website under the section Discover Nursing in Canada, the first button in red on the screen here. And here we have shown the general wages for registered nurses across Canada. This is a Government of Canada website on which one can check similarly the wages range for licensed practical nurses and registered psychiatric nurses. And by the way, as well as for other professions. This slide is not only for healthcare occupations, it's for occupations in general. This website also has information on job prospects and available positions. As you see, the breakdown is province per province, and you can click on each separate province name to see a further breakdown per region and per city. Now let's look at the application process itself. NNAS currently has two application processes for internationally educated nurses. The new expedited service started in June of last year, and the regular service. Both are based on requirements that meet the needs of nursing regulatory bodies in Canada as part of the first steps of becoming licensed or registered as a nurse in Canada. NNAS is the only organization in Canada that provides internationally educated nurses with access to all nursing regulatory bodies, except Yukon, Nunavut, and the Northwest Territories, plus Quebec. Now let's talk a little bit in more detail. What is the new expedited service, which is not so new anymore since it started in June of last year, like I already mentioned. This new service launched in the end of June 2023 and was the result of several years of consultations with the regulatory bodies, governments, with internationally educated nurses themselves, and various stakeholders like education bridging programs. The goal was to listen and learn from these stakeholders with the purpose of removing barriers so that the NNAS process can be completed in a faster and smoother way while still maintaining that public safety element, which is so important. It launched in the end of June 2023 with participating regulatory bodies and is specifically for internationally educated nurses looking to get licensed either as registered nurses or as licensed practical nurses. Basically, what happens is it is based on a streamlined set of documents, and due to the faster review of those documents, we are able to issue advisory reports within 5 business days, which is a lot quicker than our regular process. Under the regular process, it takes about 12 weeks to issue the report. It is also offered for a reduced fee compared to the regular process. The assessment fee for the expedited process is 750 Canadian dollars, which is approximately 550 US dollars for the expedited service application. When somebody pays the 750 Canadian dollars, they can select multiple regulatory bodies that are participating in the expedited service at no additional cost, which can be a significant cost saving for applicants. For comparison, the regular process is 650 American dollars, and you pay an additional fee each time you select an additional regulatory body. And what is the regular service? The NNAS regular service has been in place for nearly 10 years. It is offered in partnership with participating regulatory bodies to review the credentials of internationally educated nurses that have not chosen to move to the expedited service. The service is for all 3 designations. In other words, for internationally educated nurses looking to obtain licensure as registered nurses, licensed practical nurses, or psychiatric nurses. Additional documentation is required compared to the expedited service. Once all documents are received, an advisory report will be released within 12 weeks. The fee, as we mentioned already, is 650 American dollars or about 880 Canadian dollars. Additional nursing professions and additional nursing regulatory bodies can be selected, but for additional fees. Evaluation for an additional nursing profession, for example, is $220. And advisory report to an additional regulatory body is 55 American dollars, or about 75 Canadian. In order to be eligible for either service, the applicant needs to have completed and graduated from a post-secondary nursing education program outside of Canada. This table lists the participating regulatory bodies in each service respectively. You have the regular service on the right and participating regulatory bodies in the expedited service on the left. It is the regulatory body's decision whether they want to join the expedited service or remain in the regular service. We continue to work with other nursing regulatory bodies to hopefully have more come into the expedited service. And now we will walk you through the 4 easy steps you need to complete during the NNAS application. When an applicant wants to begin their NNAS application, it doesn't matter whether they are in the regular or in the expedited service, they always go to the Apply Login link from the NNAS homepage and create their account. As part of the process, you will be asked to provide an email address, answer 3 security questions, read and agree to the terms and conditions. Next, you will select which provinces you wish to apply to. You will see a list of all regulatory bodies participating in both the regular service and the expedited service. After completing the personal information section and application form, you will be asked to provide credit card payment information. Visa and MasterCard are accepted. Debit cards are not accepted because our system is not set up to work with them. You will receive a welcome email with your NNAS identification number between 24 to 48 hours after your payment has been made and accepted. Step 2 is to complete the application form itself. While completing the application form, it will say that the applicant needs to disclose all information fully. If there is anything incomplete or fraudulent, the application may be delayed. The applicant has 12 months to get all the required documents submitted. If you started your NNAS application before we introduced the expedited service and are applying to one of the regulatory bodies now that is participating in it, your application will automatically be transferred to the expedited service. You do not need to do anything. Depending on where in the process you are, your portal would have been adjusted, and now only required documents for the expedited service will have to be submitted. This slide, as well as the next few slides, shows screenshots of what the NNAS application looks like. This slide illustrates that the very first thing applicants select is for which regulatory body in which Canadian province they wish to apply. Personal information is the very first thing you enter when you are completing your NNAS application form. These screenshots illustrates that applicants provide information on where they completed their nursing education, these screenshots shows that the system will assign you an NNAS ID and an application number. The application number is different for each application submitted. whereas the NNAS ID is unique. This is your unique identifier. In part C of the application form, applicants answer if they have passed the NCLEX examination, which is mandatory for all who want to practice nursing in Canada, for all Canadian graduates and for all international graduates. Then applicants provide information on registration in foreign jurisdictions. This section is about your employment as a nurse. It includes information about where you have worked and the hours you have worked. This slide illustrates the terms and conditions that applicants have to agree with before they submit the application. This slide compares the required documents in both the expedited service and the regular service. Under both services, applicants are required to submit 2 forms of notarized ID, and they can now upload these directly into the applicant portal themselves. For education, in the expedited service, a course-by-course assessment report is what the regulators require. There are 2 different education assessment reports. There is the assessment report, which is only 1 page and is required for immigration to Canada. And then there is the more detailed course-by-course report that is often required by regulatory bodies or professional licensing bodies across Canada. The nursing regulatory bodies in particular require this course-by-course report, which means it comprises already the 1-page report, but it also includes the educational transcript, the GPA, and the credit hours of the program. That must come from one of the official entities that are approved by IRCC to do course-by-course reports. Please note that the applicants are required to pay the fee to obtain a course-by-course report. And these fees vary by organization. You see the 4 organizations listed that are approved by IRCC. We recognize that there will be existing applicants who already submitted a request to have their educational transcripts sent to NNAS or have already submitted them. The regulators have agreed that they will accept those education transcripts. We will not require those existing applicants to get an education assessment report as well if they already asked the college to send the transcript directly to NNAS. It is a little bit like a grandfathering process. Applicants who have already had their educational requirements submitted will not need to repeat this step. For education requirements in the regular service, ask the educational institutions of applicants to complete the nursing education form, to send the official transcripts, as well as the syllabus or course description. It is important to note the full syllabus is only required in the regular service. It is not needed in the expedited service. For license requirements, in the expedited service, applicants need to submit their first and current nursing registration. If their current nursing registration is different from the first, they will submit 2. They will have 2 separate documents to submit. If there hasn't been a change, if their first and current registration is the same, then there is only 1 to be submitted. That document needs to come directly from the registration licensing body. Applicants cannot submit it themselves, so that is why we call it a third-party documentation. The applicant has to request that from the International Nursing Licensing Body, and the latter sends it directly to NNAS. For licensing requirements in the regular service, documentation for all nursing licenses must be submitted directly to NNAS by the official registration or licensing organization. For employment in the expedited service, no documentation is required, but applicants will be asked to disclose employment information for the last 5 years directly on the application form. For employment in the regular service, employers in the last 5 years are required to fill in the employment form and send it back directly to NNAS. This is known to take a lot of time, so we always say reach out to your past employers well in advance and ensure they are able to complete the necessary forms. And now we are going to talk about the curriculum assessment under the expedited service. Because as part of our efforts to streamline the process, NNAS introduced this new way to review international nursing education for the expedited service specifically. And this new way saves applicants both time and money, while at the same time still providing quality information. Rather than requiring the curriculum to be submitted and reviewed for each individual applicant, under the expedited service, NNAS now reviews international curriculums in depth at a country level. The educational reviews are completed by nursing experts who are familiar with the Canadian entry to practice competencies. The experts are also familiar with internationally educated nurses and the value they bring to the Canadian system. The regulators who join the expedited service understand the new educational review process and have agreed to it. They use the country-level curriculum reviews along with information in the NNAS advisory reports to inform their licensing decisions for next steps. Note that only applicable to the CNO, the regulatory body in Ontario, provided the Nova Scotia College of Nursing and BCCNM in British Columbia both come under the expedited service. Effective February 9th, 2023, NNAS will release advisory reports without requiring a curriculum assessment to applicants who have written and passed the National Council licensure examination for registered nurses on or after April 1st in 2013. If you have written and passed the NCLEX exam on or after April 1st, 2013, you can update your application with your NCLEX information by going into the examination section. This is part C of your NNAS application form. You will then see a new section where you can confirm you have written and passed the NCLEX exam on or after April 1st, 2013. You will also be asked to include your NCLEX ID number. This will allow NNAS to verify your results and include this information on the advisory report. If you do not know your NCLEX ID number, please follow the instructions in the NNAS portal. If you have not written and passed the NCLEX on or after April 1st, 2013, you do not need to do anything. Your application will continue in the process and your nursing education curriculum will be assessed. Applicants will be able to monitor their application through the applicant portal. Monitor when documents are received by NNAS and the status of your application moves through the process. Some common stages you will see on the applicant portal are waiting for required documents. This is when NNAS is waiting to receive all required documents from you. Ready for review, when all required documents have been received and an evaluator will be assigned to review your application for completeness. Ready for final review, when your application is in the final stage of the review and undergoing a quality assurance check. And finally, report issued, when you have completed the NNAS process and your advisory report is complete and available. Once all documents are collected, this is when NNAS reviews all the documentation, provided there are no issues and no further clarifications required. The advisory report will get issued within 5 business days of all the documents being received for the expedited service, or 12 weeks of all documents being received under the regular service. The advisory report will automatically be sent to the regulatory body or bodies that you have selected. It will include all documents submitted to NNAS by the applicants themselves and any third parties, as well as any correspondence that you have had with NNAS. Then you can download a copy of your advisory report and apply to the regulatory body of your choice. This slide just illustrates a sample application with the status of waiting for required documents. You see this status highlighted in yellow to the right. This slide shows a summary of a sample application. It shows what has already been sent and what documents are pending. And these are just some tips for going through the application process as smooth as possible. In terms of when the NNAS assessment process should be started, it can be done before or at the same time when you're starting the immigration process. We have an applicant handbook, which is a very detailed guide for the process that all applicants are invited to read. You, as an applicant, are responsible for disclosing all the information requested and for arranging the third parties to send the documentation to NNAS for the process. This requires regular follow-up by the applicant, in many cases, particularly with the third parties, such as previous employers and education institutions. All documents submitted must be in French or English. Monitoring the process of one's application proactively will ensure timely interaction if any follow-up is needed with NNAS or with any third parties. We highly recommend that applicants focus on the province where they are living and working, or where they intend to be living and working, because each regulatory body has unique processes and requirements. We recommend that you explore the website of the regulatory body, where you will be applying on one hand to learn about the specific registration process and requirements, and on the other hand, also to become familiar with what additional documents or fees to becoming licensed they may be asking, such as registration fees, jurisprudence exam fees, language proficiency requirements and fees, bridging program fees, national exam fees, the NCLEX. Always reach out to NNAS directly for questions about the application process. There can be a lot of misinformation out there, so always reach to NNAS first. NNAS will only communicate with the applicant themselves about their particular situation. We will not provide any information to other third parties unless the applicant has given us specific permission to do so. Some internationally educated nurses may choose to use an immigration consultant to support their journey in coming to Canada. In Canada, immigration consultants are a regulated occupation, like nurses. We encourage you to visit the College of Immigration and Citizenship Consultant website to learn more and find credible immigration consultants if you need to use one. Explore the range of free settlement services as well, available to support newcomers, from language training and job assistance to community integration programs or legal aid if needed. This page contains useful information to help newcomers become more informed about what assistance they can get when moving to Canada. You can also seek support from other organizations, such as Care for Nurses. CARE offers multiple programs at no cost for internationally educated nurses looking to practice nursing in Canada. And here we list the Care for Nurses link in the end of the first paragraph. As well as the Immigration Consultant College webpage. If you need financial assistance with covering costs associated to the licensing and immigration process, search information on microloans available for internationally educated professionals. We list here the Atlantic Immigrant Career Loan Fund, which is a microloan fund for internationally trained immigrants in Atlantic Canada specifically, providing microloans to newcomers, allowing them to overcome financial barriers, to upgrade their skills, and obtain their license or certification. And the second one we list is the Windmill Microlending, a registered Canadian charity, also supported by the Government of Canada, that offers skilled immigrants low-interest microloans to cover the various costs of returning to their profession in Canada. Many provincial governments now offer internationally educated nurses navigation services. We recommend that you visit the website of each provincial government that is applicable to you to see if they have any financial bursaries or incentives available to you. This slide lists the provincial government respective websites and services that they offer. This slide shows the NNAS website links for information on both the expedited service and the regular service, as well as the applicant handbook available in English and French. We have two ways applicants can contact us. There is the applicant support email address for written inquiries and the toll-free line. This is the first point of contact for applicants if they have questions about the NNAS application process, or questions about documentation submission, or about the report status. This email and toll-free line will connect applicants with the applicant support at our service provider, which is the CGFNS. They are the ones that have access to all applicant information. And then there is also the applicant navigator inbox. If after applicants contacted support, they still have barriers and need some additional help, you can reach out to the applicant navigator email address, and the applicant navigators at the NNAS head office will be there to support you. And now we will give time to ask questions. As I mentioned in the beginning, we do our best to answer. If we get a question to which we do not know the answer, we would acknowledge that, and we will research to provide an answer at a later time. If we do not have time to answer all questions within the duration of the webinar, we will answer questions that were submitted by email afterwards. We always answer by email to all questions that didn't get an answer live during the webinar.
We do have a couple questions from the Q&A. Who is required to write the NCLEX, and when can you do that?
Everybody is required to write the NCLEX. I'm glad we asked this question because there can be confusion sometimes. The NCLEX exam, passing successfully the NCLEX exam, is a requirement to practice nursing in Canada for everybody who was educated as a nurse in Canada and for everybody who was educated as a nurse outside of Canada. In other words, there is no Canadian province or territory where you can practice without passing the NCLEX exam, regardless of whether you studied in Canada or outside of Canada. The requirement is the same, passing the NCLEX exam. Now, in terms of when can you take the exam, Obviously, if you studied in Canada, you're given access to the exam upon finishing your program successfully. For those who studied nursing outside of Canada, it is the regulatory body that grants access to the exam. So once you have completed the NNAS assessment process and obtained your advisory report, you will go to the regulator in the province of your choice to apply for registration, and they will review the documentation and decide at what stage you can be granted access to take the NCLEX exam. Sometimes there are people who applied for registration in the USA and were granted access to take the NCLEX exam as part of their process for registration in another country, the USA, because USA graduates write the very same exam.
Is there a minimum or maximum age that you can apply?
For the exam or for NNAS, although
For
it
the
doesn't
NNAS
matter,
process.
because the answer of both questions is no, there is no age limit.
Okay. Will there be any webinars offered in French?
Yes, we are planning finally to offer webinars in French as well, at least twice a year, with the first one being scheduled for June. I'm trying to remember off the top of my head, was it June 4th or June 30th? It is on our website under resources. I believe it was June 4th when we will be offering the first webinar in French.
Is there ever a way that NNAS can waive verification requirements?
That question, I'm afraid, does not have a straightforward answer. So the global answer is no. You have to meet all requirements in order to practice. But then there are situations where you need to take a look on one basis. For example, in some countries, you practice nursing based on your diploma. There is no licensing or registration system. You finish the university and you practice as a nurse in these countries. So in those cases, obviously, the requirement to submit a license verification will have to be waived simply because there is no licensing system in the respective countries. And then that's an example of where the requirement is waived. But it's not an exception being made for a specific candidate. It's a country level decision for countries that don't have a licensing system. But applicants cannot waive requirements and cannot ask to waive requirements. You have to meet all conditions for practice and you have to submit all required documents for the assessment process.
Does NNAS offer any other services like employment or like homing or relocation?
No, this is very much outside the scope of NNAS go and work, but there are other organizations that do that. For jobs, we already showed a Government of Canada website that provides information for salaries, and that same website also has information on job availability, like what positions are available to apply for, in which province. There is even a breakdown per region and per city. For relocation, there are many immigrant settlement services agencies that provide assistance with anything related to settlement, anything from advice and information to other more concrete assistance with, I really don't want to give examples because I don't want to overstep. But across Canada, we are happy to say that there are a large number of services for immigrant settlement that are there to assist you.
And can you apply to more than one regulatory body at a time? What if one is in the expedited and one is in the regular?
Absolutely, you can apply to as many as you want at a time, but it will be costly. Especially in the example that you are giving, if one is in the expedited process and the other is in the regular one, you will be paying both fees separately. Although you are submitting the application at the same time, you will be paying the expedited service fee for one of the applications and the regular service fee for the other application.
And I think this will be our final question. If you've written the NCLEX in the United States and passed it successfully, would you need to write it again in Canada?
No, if the result is still valid, you do not to retake the exam. You will be able to log in into your profile and update the examination section, part C of the application form, particularly if the exam was passed on or after April 2013, you do not need to retake the exam.
Sorry, actually, I'm going to do one last question. Do you need a job offer before you can apply for NNAS?
No, you do not need a job offer to apply or to take the exam.
Great. So I think that's all the questions that we're going to answer live for today. For anyone that has asked a question in the Q&A that has not been answered as of yet, and there is an email, we will get back to you shortly.
Thank you, Tavia. And thank you to everybody attending this webinar today.
Yeah, I will conclude the webinar for today.
Thank you.